You've had your blood pressure checked more times than you can count. The cuff tightens around your arm, you hear the little beep, and a nurse or a machine gives you two numbers. Most people glance at the top number, hear something like, "You're fine," or "That's a little high," and move on with their day. But here's something almost nobody explains to you in that 5-minute appointment. The number you're ignoring might be more important than the one you're watching. And once you understand why, you'll never look at a blood pressure reading the same way again. Let's start with what those two numbers actually mean, because most people have never had this explained in plain language. When your heart beats, it squeezes and pushes blood through your arteries. That's the top number, called systolic pressure. Then, in between beats, your heart relaxes and refills with blood before the next squeeze. That's the bottom number, called diastolic pressure. So really, your blood pressure reading isn't just one measurement. It's a snapshot of two completely different things your heart is doing over and over, thousands of times a day, every single day of your life. For decades, most public health messaging focused almost entirely on the top number. High systolic pressure got the headlines. It's the number doctors mention first, the number that shows up in most home blood pressure monitor displays in bold, and the number most people fixate on when they check their readings. But here's the part that surprised even some cardiologists. Research tracked by organizations like the American Heart Association has shown that elevated diastolic pressure, that quieter bottom number, can signal cardiovascular strain even when the top number looks completely normal. In other words, you could walk out of a doctor's office feeling reassured when your body is actually sending you an early warning sign that just wasn't part of the conversation. So why does this happen? Think of your heart like a muscle that never gets a day off. Every single beat is followed by a recovery phase. That's the diastolic phase, the relaxing and refilling stage. If your arteries have lost some of their natural flexibility, whether from age, inflammation, or years of certain lifestyle patterns, your heart has to work harder even during that resting phase just to keep blood moving efficiently. Imagine trying to relax after a workout, except your body never actually lets you fully rest. It's subtle, it's slow, and it's the kind of thing that can go unnoticed for years, quietly increasing strain on your cardiovascular system long before anything dramatic happens. Now, here's a question worth sitting with for a second. When's the last time you actually looked at your bottom number instead of just the top one? Most people genuinely can't answer that. And that's not a knock on you. It's a knock on how blood pressure gets explained in the first place. If you've been shown two numbers your whole life and only ever had one of them explained to you, you were never given a fair chance to actually understand your own health. Let's go a layer deeper, because understanding why this number gets overlooked tells you something important about how health information generally reaches you. Systolic pressure is easier to talk about because it responds more dramatically to obvious things. Stress, caffeine, a stressful conversation, a flight of stairs. It moves in ways that feel intuitive. Diastolic pressure is subtler. It reflects the underlying condition of your blood vessels themselves, how elastic they are, how much resistance they create, how efficiently your circulatory system operates when it's not under acute stress. That's a harder story to tell in a 15-minute appointment, so it often just doesn't get told at all. This matters more the older we get, and this is where a real pattern shows up in the data. In younger adults, isolated diastolic elevation is sometimes the earlier warning sign of developing hypertension, even while systolic numbers stay in a comfortable range. But as people move into their 50s, 60s, and beyond, the pattern tends to shift. Systolic pressure often climbs as arteries naturally stiffen with age, while diastolic pressure can actually decrease. That shift, called a widening pulse pressure, is itself something cardiologists pay close attention to because it reflects changes in arterial elasticity that matter for long-term cardiovascular risk. This is exactly why blood pressure isn't something you check once and forget. It's a moving story your body is telling you over years and decades, not a single number on a single day. Here's a question for you, and I want you to actually think about this one instead of scrolling past it. Do you know what your blood pressure looked like 5 years ago compared to today? Not just whether it was normal, but the actual trend. Has your bottom number crept up, stayed flat, or dropped as your top number rose? If you don't know, you're not alone. And that's exactly the gap we're closing together in this video. So what should you actually do with this information? First, start paying attention to both numbers every time you check your blood pressure, not just the one that gets read out loud first. If your diastolic number is consistently sitting above 80, even while your systolic number looks perfectly fine, that's worth bringing up directly with your doctor, not because it's necessarily an emergency, but because it's a data point that deserves its own conversation instead of getting lost in the shadow of the bigger number. Second, if you're someone who gets your blood pressure checked only once a year at a routine physical, consider tracking it more consistently at home. A single reading is a snapshot. A pattern over weeks and months is a story, and stories are what actually help you and your doctor make good decisions. Think about how this plays out in real life, not just in theory. Picture someone in their late 50s who goes in for a routine checkup every year without fail. Every year, the same thing happens. The nurse reads out a systolic number in the acceptable range. The doctor nods and the appointment moves on to the next topic. Nobody mentions that the diastolic number has been slowly climbing year after year, sitting at 78, then 81, then 84. On paper, nothing ever triggered a conversation because the number everyone was watching stayed put. But underneath that unremarkable top number, there was a slow, steady story unfolding that never got told until, for some people, it eventually does get told, just later than it should have, and in a much more urgent setting. This isn't a scare tactic. It's simply what happens when only half the information gets attention for years at a time. There's also a simple, often overlooked lifestyle connection here worth understanding. The elasticity of your arteries, the very thing that influences your diastolic pressure, responds to things you already have some control over. Regular movement, especially the kind that gets your heart rate up consistently rather than in rare bursts, has been associated with improved arterial flexibility over time. Reducing sodium intake affects fluid retention, which affects the total volume your heart has to manage with every beat. And chronic, unmanaged stress keeps your nervous system in a heightened state that can affect vascular tone even when you're sitting still on your couch. None of this is about perfection. It's about understanding that this quiet, ignored number isn't fixed in stone. It's responsive, which means it's something you actually have some influence over, starting today, not just something to worry about and feel powerless around. Let's bring this back to something practical you can literally do tonight. The next time you check your blood pressure, whether it's on a home monitor, at a pharmacy kiosk, or at a doctor's appointment, don't just glance at the number and move on. Say both numbers out loud to yourself. Write them down somewhere, even just in the Notes app on your phone. Over the next few weeks, start noticing whether that bottom number stays steady, creeps up, or moves at all. You're not trying to diagnose yourself. You're simply making sure you're finally paying attention to the full picture instead of the half of it you were handed by default. Here's one more question before we wrap up, and I'd genuinely love to know the answer in the comments. After watching this, are you going to start tracking your diastolic number too? Or has this changed how you'll think about your next blood pressure check completely? I read every comment, and this is exactly the kind of everyday health information that makes the biggest difference when it actually reaches people instead of staying buried in a textbook or rushed past in a 5-minute appointment. If this helped make sense of something you've been shown your whole life but never actually had explained, that's exactly what this channel is here for. Taking the numbers, the tests, and the terms doctors use every day and breaking them down so you actually understand what your own body is telling you. There's a lot more hiding behind the numbers you think you already know. And in the next video, we're going to look at another one of them, the one that might matter even more than the blood pressure reading you just learned to actually pay attention to.